Members of Access Dorset have been given an opportunity to look into changes occurring in health and social care. There is a recognition that patients should have more control, and we want to find out what that really means, how it will work, and what help is available for patients in Dorset. So, who among us has heard of or knows what the term self-management means?
No.
No.
Is it where people manage their own packages?
Well, I think it means managing your own care. That is, you get your own budget and you manage what you do with it.
It could be where they can manage on their own and they don't need anyone to look after them, I guess.
No. You have to do everything yourself and you can't go to anywhere.
Manage your own money, basically.
Few different ideas there then.
Living with a long-term health condition can be pretty tough, but there's a lot of buzz right now around the term self-management. So what does that mean and how does it benefit us? In our area, we've been told that My Health, My Way is a good place to start.
So my name is Anya, I live in Dorset and work as a self-management coach for My Health, My Way. My Health, My Way is a service to support people who live in Dorset with any kind of long-term health condition or people who care for somebody with a long-term health condition.
What actually is self-management and why would we buy into it?
So self-management is about people having the knowledge, confidence and skills to manage their own health on a day-to-day basis. And this is about kind of really three elements. So there's the medical side of our condition, how we're feeling emotionally about everything that's happening, and then our sort of social and day-to-day life. So it's about making sure people have the best health outcomes for their health condition, but also that people feel as happy and have that as much quality of life as possible with a health condition. I mean, for me personally, I know that self-management works because I've seen it support me to be able to live well with my health conditions, and I also have lucky enough to be able to see it working in practice with everybody that I work with on a day-to-day basis.
My name's Sam, getting on a bit now, and have transverse myelitis, and I was struggling a lot on my own until I met My Health, My Way. You have a coach that regularly meets and talks with you, sets goals with you, helps you improve your life, helps you to exercise, and as one of my goals was to walk the dog, which he wasn't getting any walks when I first met My Health, My Way, because I'd lost my confidence to go out. But they've helped build my confidence with the meetings, by using the internet and to access other help that when you're on your own you don't know is there. So it's been something that's completely changed my life around.
Sometimes there can be misunderstandings that it's about self-diagnosis, self-treatment, about doing everything yourself and not really contacting healthcare professionals, or it's about actually being really medical and scientifically trained yourself so that you know the difference between your atriums and your ventricles, for example. And actually that's not really what self-management's about at all, because if it was I wouldn't be doing it, because that sounds far too much like hard work. For patients, it's really important that we understand that this isn't about going it alone. I know the word self-management has the word self in it, but actually this is about making sure that you're confident and comfortable with a good support team around you so that you can manage your health condition.
So I'm a little clearer now. Anya talked a lot about support, which can really come from a number of different places. In Bournemouth and Poole, people living with lipedema and lymphedema found they weren't getting all the support they needed from the NHS, so they formed a group to support each other.
My name is Margaret Butler. I am chairman of the Bournemouth and Poole Lymphedema and Lipedema Support Group. And I learned as much, everything from other people. Realising that you're not going to get any support from the hospital or from the GP, the only other people that can help you is people who suffer.
A little group like this is fantastic, really, because they know how things affect you and don't affect you. Whereas, somebody in a clinic room may have read the textbook, but they don't actually know. They're not you. So they don't know how much pain you're in or how much you struggle daily just to do the simplest little thing. Whereas everybody here does.
Somebody's poorly, we give them a little ring and say, how are you? And, because we all have our downs. with our health. Because some people, it's not just lymphedema, it might be something else as well. So we try and take care of each other.
So, can this peer support approach work on a larger scale? To find out, we went to the MS Society. Run by volunteers, the Society also provides access to services like counselling and physiotherapy.
Pivotal to people with MS is their ability to have physiotherapy. So there's a variety of equipment in the physio area with the bike machines, standing frames, floor exercise, tilting beds. We employ 2 physios for the 3 days that we're open.
As far as my health condition, it's up to me to manage it, and you get all sorts of advice about what to do, how to exercise. If there's there's people here that you can ask. They'll give you all sorts of advice. Certainly the 2 physios, they do help. They tell you the exercises that are good to do. And that's all down to me.
But one of the main things people coming here is socialising. We've got a craft room and a hairdresser's. We've got a library. This is our main area where we'll have not just lunch, and we'll have social evenings, entertainment. And at lunchtime we'll have 35, 40 people here for lunch.
To live independently with our health conditions, we're going to need to be well informed and be receiving good advice. So where do we think we can go for this information and advice?
Maybe doctor? My daughters.
I'll go to Age Concern.
My first place I'd go to is the probably Pool Council.
So we have a few different suggestions, including a local council, which made me wonder, what sort of information and advice services are offered by local authorities? I met with Alison Stark at Bournemouth Borough Council. So our group acknowledge there's lots of information and advice out there, but it's quite a minefield and quite disconnected. Where would we start if we wanted to find some information on how to live more independently?
Well, in the first instance, someone could phone their local authority. So across the 3 local authorities, we've got help desks. In Bournemouth, ours is called Care Direct. You do not have to be having services from the council at all in order to phone that help desk, and you can get information about staying independent in the community and living at home.
What do you think the main difficulties are with information and advice?
Well, it's very easy for us as a local authority to get into our jargon and expect people to understand what we mean all the time. As part of the work that I'm doing in Bournemouth, I've been going out and meeting a range of people. So I've been working with older people with disabilities, with young people as well, to get their perspectives on how best they need to access information.
We've heard the council have put a lot of information on a new website. Can you tell us a bit about that?
Yes, by all means. My Life, My Care is pan-Dorset, so Bournemouth, Poole and Dorset use My Life, My Care, and it's got a huge amount of information around keeping independent, so people can look on there for all sorts of things to get advice and support with keeping themselves independent and getting access to community support. But there's also a search engine in there, so if you put your postcode in, for example, you can just look for anything that's available in your area to you.
So we've learned that self-management is about taking control of our own health conditions and not just going along for the ride. It doesn't mean diagnosing ourselves or doing everything alone. In fact, we need to work together in partnership with health professionals. To self-manage, we need to make sure we have all the right information and surround ourselves with support we need to give us the confidence to make decisions, manage our conditions day to day and take control of our lives.